Hi everyone, I'm Janae. I'm a young person with Off the Record Support Services, and today we are joined by Dr Wale, who is a practicing GP who works closely with Croydon Social Prescribing, which is a community-based health and wellbeing initiative. So at the moment there are lots of fake news and myths around COVID-19, and we're feeling a bit worried and really anxious. So Off the Record invited you to send in your COVID related questions to ask Dr Wale. We hopefully, having a credible source to answer your questions, will relieve any stress and anxiety that you've been struggling with so far.
Perfect. Thanks for having me on, Janae, and hopefully I can answer the questions to the best of my ability.
Right, Dr Wale, the first question from a young person is, I'm a young person, how likely is it that I will get COVID?
So currently the thinking is being young in itself isn't a risk for contracting COVID. However, there are two risk categories, high and moderate risk. You're considered high risk if you have certain pre-existing medical problems that suppress your immune system. So for example, if you've got certain cancers, cystic fibrosis, certain conditions that require you to take drugs that suppress your immune system, then you are higher risk. You should already know if you're in this category because you should have received a shielding letter from either the government or your GP. If there's any confusion whatsoever, as if you're high risk, then please just contact your GP.
Okay.
The second risk category is the moderate risk group. Now, these are people that are vulnerable but don't actually require shielding. And these include people that are over 70, if you're pregnant, or if you're taking certain medications such as steroids, or if you have diabetes or chronic kidney disease, or if you're very obese. Now, the moderate risk group don't have to shield, but they do, like the rest of us, have to adhere strictly to the social distancing measures, which are obviously changing as time goes on. So to answer the question specifically, being young in itself means that you're not high or moderate risk of COVID, unless you have any of those kind of pre-existing medical conditions, medications that I mentioned. And if you go to the nhs.uk website, you can see a very comprehensive list of the people that are high and moderate risk.
Okay, thank you for that. That was really interesting. So that answers our second question about someone's sister being pregnant and why they're not having to shield them. Do face masks really work? Are they actually going to become compulsory? I can't say it right now. Sorry.
Compulsory, yeah, it's a
Yes.
tricky one to get out. The evidence on face masks is a bit sketchy. I mean, the World Health Organization and certain COVID research groups have tried to study this in very small sample sizes. There is evidence that having a face mask or covering does slightly reduce your risk of catching COVID. Currently, the UK government advice is that you should wear a face covering, and I say the word covering because the government's saying, you know, it doesn't have to be one of the kind of certified N95 masks. So currently, a face covering should be worn in crowded or enclosed areas, but it's not compulsory.
Okay.
I don't know whether they'll make that mandatory.
Mm-hmm.
We'll have to wait and see.
Are there particular fabrics that work better to make sure you're protected?
Strictly speaking, the best masks are something called the N95 masks, which are made from a special material that helps filter particulate matter. So not everyone can get hold of these. And in the absence of that, what the government is saying is any opaque face mask, a scarf, even some homemade ones that cover both the nose and mouth but still allow you to breathe, are
Mhm.
acceptable.
Okay, thank you. All right, the next question is, does the current swab test actually identify COVID-19, or will it come up positive if you've had the flu jab?
So no, it won't come up positive if you've had a flu jab. I myself have had the flu jab and also had a swab which tested negative. So that's proof of that. But yes, the swab test does identify people who are currently positive with COVID-19. So if you've had it in the past but don't have an active infection, it may still come up negative.
Okay. How do I build up my immunity while I'm healthy so that if I get COVID-19, I stand a good chance of not getting too unwell? Is there anything that I should be drinking or eating?
Well, yeah, the standard advice with regards to looking after yourself, even in the absence of COVID-19, still stands. So things such as maintaining a healthy diet are helpful, adequate sleep, good nutrition, exercise. This is a good time to quit smoking if you're a smoker. And also vitamin C is something that can help boost the immune system. So all of the things that your doctor and society advise that help people's health still stand. I think it's also quite important to keep a positive mind state as well. With a lot of the stuff that's in the media, understandably, people's anxieties are high, but being mindful, talking to your friends and other people if you do have worries, so you can share that burden. But to reiterate, just the bog standard stuff that helps your immune system function. So good sleep, good nutrition, vitamin C, some daily exercise and mindfulness.
Yeah, those are really good steps. Thank you. Can we still safely drink tap water?
Yes, you can, yes. Water's a liquid medium, and generally COVID is transferred via something called an aerosol droplet. So contaminated surfaces, contaminated hands. So, you know, all the hand washing advice is still recommended, but yes, tap water is safe.
Thank you. Do you mind explaining what an aerosol droplet is for people that don't know?
Yes, of course. Medical jargon, sorry, it's a
It's fine.
habit. But they're tiny particles in the air that you can't really see with the naked eye, but exist. So, for example, when someone coughs or sneezes, they release these tiny particles into the air, okay? And either they're inhaled by someone else or they settle on a surface, which is why hand washing and also covering your mouth or face if you sneeze or cough is crucial in stopping these aerosol droplets from getting out there and also remaining on surfaces.
Yeah. Would it be more important to cover your mouth with something other than your hands, especially if you're touching surfaces and you can't quickly wash your hands as well?
100%. The current advice if you cough and sneeze is to try and cough or sneeze into your forearm as opposed to your hand. You should still
Mhm.
try and wash your hands after you do this as well. But yeah, avoiding your hands because that's what you're most likely to then go and touch other surfaces with, as opposed to your
Mhm.
forearm or elbow.
Okay. I've heard that people in Black and minority ethnic communities have been most affected. Is this true? If so, why?
It's a brilliant question and something that I think the government are going to probably launch a public inquiry into. The short answer is it's not fully understood why,
Mhm.
but if we look at it logically, especially within England, especially, Black and ethnic minority groups make up a larger proportion of the frontline jobs in the UK than they do in the community. So I'll give you an example. It's thought that the Black and ethnic minority population in London is about 14% of the whole population. But if you look at the proportion of Black and ethnic minority people that are in frontline jobs, it's about 35%. So although we're only 14% of the community within London, we actually occupy up to 35% of some of these frontline jobs, including things like security, bus drivers, nurses, healthcare assistants, carers, and we know frontline workers are more at risk of contracting COVID-19. So one possible explanation for that could just be that you find Black and ethnic minority communities in higher proportions in the jobs that are at risk of catching COVID-19.
Okay.
That's possibly one explanation. And the second is that some of those pre-existing conditions exist more prevalently. They're more prevalent in Black and ethnic minority groups. For example, things such as diabetes, kidney disease, or high blood pressure. But I think the full answer as to why BAME communities are more affected will only come out when there's a full inquiry.
Okay, yeah. Do you know if when they'll be doing it by any chance, or?
A lot of intention has been mentioned within Parliament, but as of yet, I'm not aware of an official date as to when that will be launched. I'd imagine it's probably once the pandemic's under control or over.
Okay, yeah. Thank you. When are reliable antigen tests come in, and when can everyone get one?
Sure. So there's a slight difference between antigen and antibody tests, but just to briefly break it down, the current swab only tells you if you have COVID-19 coronavirus at the time of testing. Antibody tests are valuable because it tells you if you've had it at any given time and if you're then immune to it. They do exist. So Public Health England have identified an antibody test which they feel is very accurate, over 90% accurate. Matt Hancock, the health secretary, as of 2 days ago, said that they were in the final stages of closing a deal to buy millions of these tests. So hopefully, in the coming weeks, these should be made available to the public.
Okay, thank you. Do you know if someone's had COVID-19 already, will this then affect them, or would they be able to get it again after that?
Very good question. And the truth is, that depends on how many strains there are of COVID-19. The truth is, just like any other virus, when you get it and your body's immune system tackles it, you do have immunity to it for a period of time. We don't know how long yet, okay? The problem is, if you get one strain and become immune to it, a different strain has a slightly different structure, meaning there is a potential to get this virus more than once. But I have to stress, it depends on how many different strains of the virus there are and how different it is from the original strain. And again, we don't currently know that. There has been some research to suggest that there could be up to 12 strains of the virus. But again, those are in very small population studies. So we still need more information.
Okay, yeah. Thank you. My mum says I can't go out when it's raining because COVID-19 is in the rain, or I might have an increased chance of getting it then. Is this true?
Old mother's tales. Yes, if you go out in the rain, you'll catch a cold. Now, the truth is, no, I don't think there's any evidence to suggest that you're more likely to catch COVID-19 if it's raining. No, I don't. I'm not aware of any evidence that suggests that, no.
Okay. So is it not true that if you go out when it's raining, you won't catch a cold? Because I've always thought that.
Well, these are funny things. The truth is, I don't think there's a direct link. I think the issue comes in that if you become wet when it's raining and you don't dry off quickly, you lose more body heat, which makes you more susceptible or prone to catching viruses. But no, rain, walking on the bathroom with bare feet is another one that I've heard. But no, I don't think that increases your risk of catching a cold or COVID-19.
Okay, that's brilliant then. That is a relief for myself. um, my mum is worried getting takeaway increases our chances of getting COVID-19. Is this true?
Well, the short answer to that is no, because the hope would be that if you're getting a takeaway, the food is cooked. And usually, cooking food at the temperatures you do does destroy a virus.
Mhm.
However, we do know that the coronavirus can survive on surfaces such as cardboard for up to a day,
Okay.
plastic for up to 3 days, and even on metals for up to 4 hours. So my advice is, if you want to get a takeaway, do so. But all of the regular hand washing, hygiene advice is still recommended. So, pick up the takeaway, wash your hands
Yeah.
before and after eating.
hmm So can it get onto like normal food, so like fruits and grapes and stuff like that?
Again, the evidence is a bit sketchy, but I think the safest way to avoid any contamination, especially with cold foods, you make a good point because they're not cooked,
Mhm.
is probably to
Yeah.
wash them. Wash your hands and wash them before consuming them. I mean, most people do anyway because
Yeah.
they've washed their hands before, they reach your table. But yeah, I would say, if you're going to eat an apple, some grapes,
Yeah.
just give them a rinse.
Wash. Yeah, no.
Yeah.
That's brilliant. Um, why do we have to take COVID seriously?
Well, we have to take it seriously because it spreads extremely rapidly, and for vulnerable people, it can be a killer. And it's changed the world that we live in today. A lot of people have lost loved ones. Um, it's something that isn't confined to any particular section of society or country. You know, it emerged in early January. In the space of 5 months, there are now 5 million cases worldwide. So, yeah, we do have to take it seriously because it affects all of us. Um, and really, it's something that we need to fight together.
Yeah, definitely. Is there any advice that you can give to vulnerable people like myself? Like, all you get told is to shield, but there's nothing else that you're told that can keep you safe, or when you need to go out, like it's been a long time inside. So yeah, any
Yeah.
advice?
100%. It's really difficult to stay kind to one place for a long period of time, especially when there's the anxiety that, any contact could put you at risk. But what I would advise people that are shielding, or even people that are social distancing and confined to their houses, one, have a daily routine.
Yeah.
Set yourself a plan of something that you're going to do for the day. Whether it's reading, watching a movie, doing an exercise routine inside. Try and have a structure so you can fill your day with something. And also, don't keep yourself isolated. I mean, Zoom's brilliant. We're
Yeah.
using technology to connect. So, as well as planning structure for your day, I think it's really important to try and spend some time daily connecting with someone, anyone, even if it's via social media, family, friends, and also just taking small steps to make sure you have everything you need. So if you're in a vulnerable risk group, contacting your GP, making sure your medication doesn't run out, finding out which pharmacies can deliver to you, just having things in place so you know that you won't have yourself in a situation that could increase your anxiety. So, in a nutshell, structure is very important, routine's very important, contact with others is very important, and also being mindful. If you feel yourself getting stressed, if you feel that things are getting on top of you, and even if you don't have someone to talk to, there are a number of organizations that can help. Your GP can link you in with a lot of these, but to name a few: Samaritans, Mind, Off the Record for
Yeah.
young people, and even just someone that you trust to speak to. You know, a burden shared is a burden halved.
Yeah, no, definitely. Thank you. With possibly returning to school in the next few weeks, I have not had any symptoms. I'm worried that I might catch the virus when I go back to school or start integrating back into society. When the self-isolation lifts, how do we know that this virus won't just flare up again?
Yeah, that's a very good question, and something that's still actually up for debate amongst the experts. Um, Watching the government briefing and the news yesterday, there are actually some councils, controversially, they say Labour councils up and down the country, who are saying that regardless of government advice, they're not going to reopen schools on June the 1st. Now, really, the question is about the rate of infectivity, and without getting too sciencey, they talk about something called the R number, which is basically how quickly the virus will spread. So the R number refers to how many people one person with the infection can infect.
Yeah.
The government thinking at the moment is that if that number's below 1, so if there is someone with the virus that goes out, they're likely to infect only one other person. Their thinking is if that number is less than 1, that we have a good chance of being able to return to school safely with social distancing measures in place. Now, the argument that a lot of head teachers are making, and rightly so, is how do you socially distance kids? Because naturally, and to be honest, that's not something that I think even the government has provided a clear answer to. They say, working on guidance as to how this is going to happen. And some things that they've suggested is stuff like smaller class sizes, people going to school at different times, only allowing certain year groups back first. But the truth is, to answer the question directly, how do you know you won't catch the virus when you go back to society? The truth is that we don't, but we have to have faith in the science and the government that they're only going to allow people back once it's safe to do so. And they're basing that on the current levels of infection. Now, the good news is the number of new cases are going down, the number of deaths are going down, which would suggest that, the virus is starting to run its course. So the truth is, we have to wait and see.
Yeah.
And I think the second question was, when self-isolation lifts, how do we know that the virus won't flare up again? Now, again, these are almost impossible questions to answer because it would require you to have a crystal ball. But if we look at other countries that have lifted the lockdown already, so I think good examples include countries like Germany, South Korea, even China. When they did lift the lockdown, there were very small increases in the number of cases, but those were quickly shut down by testing and contact tracing. Okay.
Yeah.
So those two are one of the biggest tools that Public Health England and the government are going to use to keep all of us safe. All right. So I personally think isolation won't be lifted until we've got contact tracing and testing down to a T, because it means if we identify someone who has got the virus and we can identify all of their contacts quickly, we can isolate those people quickly to stop it from flaring up again.
Okay, yeah, that's brilliant. Thank you. Do you know how the R numbers are calculated or worked out?
Yeah, that's a brilliant question as well. I mean, they always admit that they have to be cautious. There's a government group called SAGE, which uses complex science and modeling. So basically what they do is they look at the number of confirmed cases within a specific area,
Mhm.
and they look at historical data, which they then put into a very clever computer, which then makes a prediction as to how quickly the infection's spreading. So
Okay.
at the height of all this, when we were getting, new cases and a relatively high number of deaths a day, unsurprisingly, the computer said, the R numbers above 1 or 2, saying that the virus is spreading exponentially. But now that the number of cases are falling, the number of deaths are falling, the algorithm, the computer's assuming that, that must be because the rate of infectivity is falling. So in short, they use a very clever computer and a lot of data to try and calculate the R number, but it's not an exact science. Even they admit they're not 100% sure.
Okay, yeah. My parent has been self-isolating in their room because they have symptoms of COVID. How long should they do this for, as I'm worried that I might catch it?
Sure. So at the moment, if you have symptoms of COVID, you should self-isolate for at least 7 days from the onset of the symptoms. Although it's important to stress, if after that 7-day period you still have symptoms, you should continue to self-isolate until your symptoms are completely gone.
Mhm. Okay, thank you very much. And should the other person in the house, so this young person, should they still be staying in the house and not going in near anyone?
Yeah, so if you're in a household where someone has symptoms, then you yourself should self-isolate for 14 days.
Mhm.
And that's because of what we call the incubation period. In that period of time, you could still catch the virus. Now, again, what's really important here is if someone in your house has symptoms and then you self-isolate for 14 days, but let's say on the 13th day of that, you then develop symptoms,
Yeah.
you should then still self-isolate for a further 7 days from the day that your symptoms appear.
hmm Okay, yeah, thank you. So, say for people with parents that have disabilities, and say if they have a carer come over, how should they try it and safely live, I guess?
So that's a very difficult thing to do if you're a carer for a family member but not a formal carer. The truth is, if you care for a family member and you're living with them, then you're within that category of people that are considered to be living together. So all the normal kind of social distancing and self-isolation measures apply. If it's an external carer from an external agency, they shouldn't be entering the house of a vulnerable person without wearing what we call full PPE, personal protective equipment. So that includes a mask, gloves, apron, and a visor. Now that's been a point of contention on the news, and PPE, people getting their PPE, etc. But the truth is, we know that if you wear full PPE as a carer, your risk of transmitting or contracting and then, transmitting the virus to someone else are relatively quite low. So
Okay.
the key for external carers is they should be wearing full PPE when they come to visit vulnerable people. And if you're a carer for someone who's in your house, then just all the same kind of rules apply.
Do you think there's anything else that is vital for any young people to know at the moment?
Yeah, I think the thing is to remain hopeful. We're all in a very difficult time at the moment, but the truth is it will pass. And I think the important thing is just to preserve yourself during this difficult time. So although it can feel like the world's ending and there's no light at the end of the tunnel, I think self-preservation, in terms of physical and mental health right now is very important because there will come a time when this will pass.
Okay, so that's the end of our questions. On behalf of Off the Record, we want to say a big thank you to you, Dr. Wale, for all your helpful answers towards the questions for the young people. We hope that we've given much clarity to the young people who have submitted these questions, as well as many other young people watching this video. Remember, if you're aged 11 to 25, living in Croydon, Sutton or Merton, please have a look at Off the Record's website for lots of useful information on the support available to you during these times. Take care, be safe, and goodbye.
Bye. Thanks for having me, Janae.
Thank you.
Take care. Bye-bye.
Thank you so much. Bye-bye.